Hi, good morning Nicole. My name is Mihira. I'm your invigilator for the OET-speaking session on the 11th of August 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Nicole Mayfield.
Okay. What is your candidate num?
My candidate number is 255222552.
All right. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
How would you handle a situation where you have a difficult and uncooperative patient?
In situations like this, I prioritize maintaining a calm and compassionate approach. I would start by actively listening to the patient's concerns and validating their feelings. I'd try to understand the root cause of their behavior, whether it's fear, pain, or frustration. I would involve the patient in their care plan, explaining the importance of their cooperation. If necessary, I would also collaborate with the interdisciplinary team and seek guidance from experienced colleagues to find the best approach for providing effective care.
If you realize you have made a medication error, what steps would you take?
Patient safety is paramount. If I discover a medication error, I would first ensure the patient's immediate well-being. I'd inform the charge nurse and the physician, if necessary, and closely monitor the patient for any adverse effects. Following the hospital's protocols, I'd document the incident accurately and thoroughly. I would also initiate an open and honest conversation with the patient and their family, explaining the situation, the steps taken to rectify it, and the measures in place to prevent future errors.
How do you handle a situation where you have multiple patients with urgent needs?
Managing conflicting priorities is a common challenge in nursing. I would start by quickly assessing each patient's condition and prioritizing care based on the severity of their situation. Effective delegation to the nursing team is crucial. I would communicate clearly with colleagues, involving them in the care plan, and redistributing tasks as needed. Regularly reassessing patients and keeping open lines of communication with the interdisciplinary team ensures that everyone is aware of changes and can provide support as required.
How would you provide care and information to a patient who doesn't speak English?
To ensure effective communication, I would first assess the patient's preferred language and use professional interpreter services, such as in-person interpreters, phone interpreters, or translation apps. I would make an effort to use nonverbal communication, gestures, and visual aids to convey important information. It's crucial to involve family members if appropriate, while ensuring patient confidentiality. Written materials in the patient's language can also be helpful for providing essential care instructions and educational materials.
How would you support a family coping with losing a loved one?
During such a difficult time, my focus would be on providing emotional support and empathy. I would approach the family with sensitivity and compassion, giving them the opportunity to express their feelings and concerns. I'd answer their questions honestly and openly, and provide information about the next steps in the process. Connecting them with grief counseling services or support groups could help them navigate their emotions. Additionally, I would ensure the patient's body is treated with respect and dignity, allowing the family to spend time with their loved ones, if they wish.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good afternoon, I am Nurse Nicole Mayfield. Welcome to our clinic. How can I assist you today?
Hi, I'm here because I'm really worried about my father's hearing. It is getting worse, and I'm not sure what to do.
I understand your concern. Let's see if we can figure out what might be causing this. May I know your name, please?
My name is Mihira.
All right. Mihira, can you please tell me in detail about your concern?
Well, it's been a gradual thing, but it seems like over the past year, he's been struggling more and more to hear us during conversations. This makes me concerned.
Did he have any injury?
As for an injury, I don't recall anything significant happening.
Thank you for sharing that. It's essential information. Are there any other symptoms your father has been experiencing, along with the hearing loss? Well, something like ringing in the ears, dizziness, or pain, perhaps?
No, he hasn't mentioned any of those. It's mainly just the difficulty in hearing, especially in noisy environments.
Got it. By the way, Mihira, would you like to share any further relevant information about your father's condition?
Yes. He used to work at a construction site when he was younger, so there might have been some exposure to loud noises. But he's never had hearing problems before this.
Thank you for providing that information. It's helpful. Mihira, there could be several factors contributing to his hearing loss. It might be due to the natural aging process, earwax buildup, or even an underlying medical condition. However, it's essential to have a proper diagnosis from a healthcare professional.
Is there anything I can do at home to help with his hearing?
Certainly. For earwax buildup, try using a few drops of olive oil to soften the wax, and then gently clean the outer ear with a cloth. Additionally, vitamin B12 and vitamin T supplements can promote overall ear health. However, I strongly recommend consulting a doctor before trying any home remedies.
I really appreciate your advice. I'm just worried about what might be wrong.
I completely understand your concerns. It's essential to address this issue promptly. Mihira, seeking professional help will allow us to determine the exact cause of your father's hearing loss and provide appropriate treatments or aids. Early diagnosis and intervention can make a significant difference in his quality of life.
What kind of underlying medical conditions could be causing his hearing loss?
Mihira, hearing loss can be linked to various conditions, such as diabetes, high blood pressure, and even certain medications. It's important for a doctor to evaluate his overall health and medical history to pinpoint the exact cause.
I'll definitely make sure he sees a doctor as soon as possible. Thank you for your guidance and reassurance.
You're welcome. I'm here to support you through this process. Please schedule a doctor's appointment for your father, and don't hesitate to reach out if you have any further questions or concerns. We're here to help.
Thank you so much. I'll do that right away.
Mihira, before concluding, let me summarize what we have discussed so far. Mihira, you are concerned about your father's hearing loss. Your father has been experiencing difficulty in hearing, especially in noisy environments, for the past year. He has no other symptoms, such as ringing in the ears, dizziness, or pain. He used to work at a construction site when he was younger, which might have exposed him to loud noises. Hearing loss can be caused by various factors, such as aging, earwax buildup, or underlying medical conditions. You should consult a doctor for a proper diagnosis and treatment of your father's hearing loss. I have given you some advice on how to care for your father's ear health at home, such as using olive oil to soften the earwax and taking vitamin supplements. I have also reassured you that we are here to support you and your father through this process. Is there anything else you would like to ask or share with me?
No, I am okay, nurse.
Take care, and I wish your father a speedy recovery. If you need anything else, feel free to contact us. Have a good day.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihira.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.